My name's Jessie, and what we're going to do today is pelvic floor exercises on the total gym. In my blog post I mentioned that you can make any total gym exercise a pelvic floor exercise. When you engage those muscles that stop the flow of urine, you make any exercise on the total gym a lot harder. So try that your next workout and see how it goes. What we're going to do today is we're going to do a bridge squat. What this does is it uses some of your hip muscles to potentially get your pelvic floor muscles engaged a little bit more. When you engage your pelvic floor, you also have a better chance of getting your spinal stabilizers engaged and setting your spine much better. So when you contract your pelvic floor, like you have to stop the flow of urine, when you feel where your spinal stabilizers are, your deep core muscles, you should feel a subtle tightening. And you'll see me do that when I do the exercise. Okay? So what we're going to do is a bridge squat. So when we go over to our total gym, you're going to lift your glide board up. You're going to get your hips towards the bottom of the glide board, and you're going to set up like you're doing a normal squat on the total gym. We're going to get our feet positioned about shoulder width apart. We use a small ball in the clinic once we know that a patient can do a pelvic floor contraction well, because you don't want to substitute your hip muscles for your pelvic floor. Remember, your muscles that stop the flow of urine. So small ball between the knees, you can use a volleyball or a basketball. We're going to feel for those deep core stabilizers. We're going to go on the hip bones. We'll go in an inch, down an inch. Lift the hips slightly off the glide board. A slight knee squeeze with the ball, and you're going to do your normal squat. Make sure you keep that pelvic floor engaged the entire time. So that's a basic pelvic floor exercise, the bridge squat.